Hi guys, today we are going to study about the maxillary nerve. In the last video we have studied about the trigeminal nerve and its first branch, that is ophthalmic nerve. So starting with the maxillary nerve, it starts from the middle of the ganglion and then it enters the lateral part of cavernous sinus and passes through foramen rotundum. After foramen rotundum, it enters the pterygopalatine fossa. Then it enters the inferior orbital fissure and it travels through the infraorbital groove and through the canal and comes out through infraorbital foramen. So this is the route which is explained in the form of flowchart. Middle of the ganglion, travels through lateral part of cavernous sinus, comes out of the foramen rotundum, then it comes out of the pterygopalatine fossa. And within pterygopalatine fossa it gives many branches which we will study after this, and then it enters the inferior orbital fissure, runs through the groove and infraorbital canal and comes out of maxilla through infraorbital foramen. Okay, so starting with the branches of maxillary nerve, which are very important. In the middle cranial fossa, like ophthalmic branch, it also gives a branch through the dura mater, which is middle meningeal nerve. So this is the first branch of maxillary nerve, that is middle meningeal nerve. After that it enters the pterygopalatine fossa. In the pterygopalatine fossa, it gives various branches, which are, first one is zygomatic branch, which further divides into zygomaticofacial and zygomaticotemporal. Zygomatic branch. Next is some of the pterygopalatine nerves which are joined with the sphenopalatine ganglion. So sphenopalatine ganglion is associated with the maxillary nerve. Okay, so it is anatomically associated with the maxillary nerve. Then it gives some orbital branches, nasal branches, medial and posterior superior lateral nasal branch. Then palatine branches, that is greater palatine, middle palatine and posterior palatine. Okay. Then last branch is the posterior superior alveolar branch. All these branches are given in the pterygopalatine fossa only. After that, it will give branches in the infraorbital groove and canal. So when it enters this infraorbital groove and canal, it gives two branches, main branches after posterior superior alveolar, which will be the branches MSA and ASA. That is middle superior alveolar, and ninth is anterior superior alveolar branches, which supply these three branches will supply the maxillary teeth. Okay, then after exiting, so here it exits the infraorbital canal and it comes out through infraorbital foramen, and after exiting from this foramen, after completing its roots, it gives its terminal branches. What are the terminal branches? Terminal branches are three branches, that is inferior palpebral, lateral nasal and superior labial. So, in very short, I have explained you about the maxillary nerve, that it has a very short root, but it has many branches. In the first is in the middle cranial fossa. Next, in the pterygopalatine fossa, it gives branches which are 7 branches, which further divide into various branches, and it is associated with the sphenopalatine ganglion, to which it gives branches in the pterygopalatine fossa itself only. And then in infraorbital groove and canal, it gives middle superior alveolar and anterior superior alveolar, and then it comes out to give terminal branches, that is 3 branches, inferior palpebral, lateral nasal and superior labial. So this is the root of maxillary nerve, and the ganglion associated with this nerve is the sphenopalatine ganglion. So sphenopalatine ganglion receives its branches from the maxillary nerve. This is the maxillary nerve associated with the sphenopalatine ganglion. Sphenopalatine ganglion receives its parasympathetic root from the greater superficial petrosal nerve. Which gives its fibers to the ganglion. Then after that it receives its sympathetic root through deep petrosal nerve, which join in the pterygopalatine canal to form nerve of pterygoid canal. So it gives parasympathetic fibers, it gives sympathetic fibers, and sensory root is through maxillary nerve only. So this sensory root is through maxillary nerve, which gives two pterygopalatine nerves to the ganglion, and through the ganglion sensory fibers pass to form greater palatine, middle palatine and lesser palatine branches. Then there is one pharyngeal branch also, which fibers pass through the ganglion only, and through sphenopalatine foramen this posterior superior lateral nasal branch and orbital branch fibers pass. So this is the ganglion associated with the maxillary nerve, that is sphenopalatine ganglion. So we'll meet in the next video with mandibular nerve in a very short time and in a very easy manner. Thank you.